Welcome to the Kentucky Labor Cabinet Office of Occupational Safety and Health online training resource. This course is presented as a service of the Division of Education and Training. Welcome to the module, Protecting Workers from the 2019 Novel Coronavirus. This module was prepared by the Occupational Safety and Health Administration and Kentucky OSHA. Throughout this presentation, you will hear terms for the 2019 novel coronavirus, such as 2019 nCoV and COVID-19. As this is a quickly changing environment, please note that these terms refer to the same novel coronavirus. Also note that Kentucky is an OSHA-approved state plan state. Therefore, Kentucky follows and enforces all federal OSHA regulations, so you may hear Kentucky OSHA and OSHA used interchangeably. For the state of Kentucky, Kentucky OSHA compliance enforces the regulations, while consultation services are performed by the Division of Education and Training, or Kysafe. So what is novel coronavirus? Coronaviruses are a family of viruses that can cause illness in people. Coronaviruses circulate among animals, including camels, cattle, and cats. The 2019 novel coronavirus, 2019 nCoV, now also known as COVID-19, the seventh known human coronavirus, is thought to have jumped species from animals to begin infecting humans. And how is COVID-19 different from other known coronaviruses? Several coronaviruses cause common colds, but are not significant threats for most healthy people. Other coronaviruses have caused past outbreaks, including severe acute respiratory syndrome, or SARS, and Middle East respiratory syndrome, MERS, each caused by a different coronavirus. COVID-19 is a distinct coronavirus. What are the signs and symptoms of infection? COVID-19 typically causes mild respiratory illness but can cause severe disease, including pneumonia-like illness, novel coronavirus-infected pneumonia, or NCIP. Typical symptoms include fever, cough, and shortness of breath. Symptoms begin 2 to 14 days after exposure. There have been thousands of cases worldwide. Some countries have reported infections among healthcare workers caring for sick patients. The virus can be spread among close contacts. These are the countries that have COVID-19 cases. The link at the bottom of the slide is from the Centers for Disease Control and Prevention and contains the most up-to-date information. And these are the states that have COVID-19 cases. The link at the bottom also has the most up-to-date information. What should you do if you have been exposed or infected? Prior to seeking treatment, alert your healthcare provider or occupational health clinic if you think you may have COVID-19. Tell your healthcare provider if you've been exposed to someone with the virus and have signs or symptoms of infection, as well as about any recent travel to areas where COVID-19 is spreading. Your healthcare provider can determine if you need to be tested for COVID-19. There is no vaccine or specific treatment for COVID-19, and some patients, especially those who become very ill, may require supportive care in a hospital. As far as occupational exposure risks are concerned, OSHA is closely coordinating with the CDC, including NIOSH, and other agencies to monitor the ongoing outbreak. Most U.S. workers are at a low risk for exposure, similar to other members of the general American public. OSHA does not recommend any special precautions beyond general hygiene practices for most workers. Workers in some sectors may have increased risk of occupational exposure to COVID-19, including healthcare, including in fixed facilities and EMS, mortuary services and other death care, laboratories, airline operations, border protection and passenger screening, solid waste and wastewater management, and international business travel. Follow existing OSHA standards to help protect workers from exposure to an infection with COVID-19. Employers should also remember that OSHA can use the General Duty Clause, Section 5A1 of the Occupational Safety and Health Act to ensure that workers are protected from recognized safety and health hazards that may cause serious harm. Please take note of the relevant OSHA requirements listed on the right and click the Continue button when you're ready to move on. OSHA typically responds to emergencies, including disease outbreaks, in a technical assistance posture. OSHA also provides compliance assistance to employers to help ensure workers are protected. OSHA provides technical assistance and support to other federal agencies as well as state and local partners. Please take note of the relevant OSHA enforcement authority listed on the right and click the Continue button when you're ready to move on. What type of guidance is OSHA providing? OSHA has developed a website with information for workers and employers on how to stay healthy during this outbreak. The website includes information on implementing the hierarchy of controls when workers have specific exposure risks. OSHA's guidance helps employers comply with OSHA standards and generally aligns with CDC recommendations for infection prevention. Guidance is based on anticipated hazards and risks and incorporates standard precautions, contact and airborne precautions, and use of face and eye protection. Guidance should be adapted based on the employer's hazard assessment and workers' tasks. For all workers, regardless of specific exposure risks, practice good and frequent hand hygiene, follow good cough and sneeze etiquette, avoid touching the eyes, nose, or mouth with unwashed hands. Also avoid close contact with people who are sick. Train all workers about their risk of occupational exposure to COVID-19, as well as on what to do if they have traveled to high-risk areas or have been exposed to possible cases. For workers at particular risk of exposure, in healthcare or others, discuss with them sources of exposure to the virus and hazards associated with that exposure. Appropriate ways to prevent or reduce the likelihood of exposure, including the use of engineering and administrative controls, safe work practices, and PPE. Some OSHA standards, such as bloodborne pathogens or personal protective equipment, will require worker training. For U.S. workers and employers of workers with potential occupational exposures to COVID-19, identify and isolate suspected cases, implement other precautions appropriate for the worksite and job tasks, and according to the hierarchy of controls. In all workplaces where exposure to COVID-19 may occur, prompt identification and isolation of potentially infectious individuals is a critical first step in protecting workers, visitors, and others at the worksite. Immediately isolate the person. For example, move potentially infectious people to isolation rooms and close the door. On an aircraft, move potentially infectious people to a seat away from passengers and crew, if possible, and without compromising aviation safety. In other work sites, move potentially infectious people to a location away from workers, customers, and other visitors. Take steps to limit spread of the person's infectious respiratory secretions, including providing them with a face mask and asking them to wear it if they can tolerate doing so. Please note, a surgical mask on a patient or other sick person should not be confused with PPE for a worker. The mask acts to contain potentially infectious respiratory secretions at the source, the person's nose and mouth. If possible, isolate people suspected of having COVID-19 separately from those with confirmed cases of the virus to prevent further transmission in screening, triage, or healthcare facilities. Restrict the number of personnel entering the room of a patient with suspected or confirmed COVID-19. Protect workers in close contact with the sick person by using additional engineering and administrative control, safe work practices, and PPE. What should standard, contact, and airborne precautions consist of in workplaces where workers may be exposed to COVID-19? OSHA guidance breaks this down by worker type. Engineering controls, such as isolation rooms and other physical barriers, can limit most workers' exposure. Administrative controls and safe work practices include measures such as limiting access to patient care areas, effective sharps management, and worker training. PPE may include gloves, gowns, goggles, face shields, and N95 or better respirators. OSHA and CDC recommend respiratory protection for certain workers who have close contact with potentially infectious people, including healthcare, border protection, and screening workers tending to persons under investigation for COVID-19, and those providing care for suspected or confirmed patients. Standard biosafety practices in BSL-2 and BSL-3 microbiological laboratories, including clinical labs, call for respiratory protection for certain activities, including any tasks that may generate aerosols. OSHA guidance is more stringent than CDC guidance for airline crew members tending to symptomatic travelers from outbreak-affected areas. OSHA's website recommends N95 or better respirators for these workers, while the CDC recommends face masks. In practice, such workers may not have access to respirators and may not be part of comprehensive written respiratory protection program. This is complicated by the fact that the Federal Aviation Administration, the FAA, maintains jurisdiction over safety and health of airline crew members, except where an OSHA-FAA MOU extends OSHA protections under the occupational noise, bloodborne pathogens, and hazard communication standards to cabin crew members. Whenever needed, use respiratory protection, including NIOSH-certified disposal N95 filtering face piece or better, elastomeric APRs with N95 particulate cartridges, PAPRs with N100/HEPA filters, respirators, as part of a comprehensive written respiratory protection program that meets the requirements of OSHA's Respiratory Protection Standard 29 CFR 1910.134 and includes medical exams, fit testing, and training. For those needing further assistance, please refer to the contact information on this slide, and please click the Continue button when you're ready to move on. This concludes the main portion of this module. The following slides contain questions and answers to further your understanding.